and welcome back to In the Gray Area with Rev Health. I'm Brittany.
And I'm Travin.
And last episode, we actually got a chance to sit down with one of our friends and patients, Levi Gurno, which was a great episode. If you've missed it, I highly recommend that you check it out. Today, we are going to dive in deeper to the positive effects of testosterone and why it's not just for men and not just about sex.
That does seem to be the popular sex and muscles. That's usually what people think about when they think about testosterone. But yeah, like you said, it's totally just as beneficial for women as it is for men. I think a lot of people, women included, don't even realize that as a female, you actually have higher levels of testosterone than you do any other hormone. You know, estradiol, even progesterone, like you have higher levels of testosterone. And so, you know, you get the same positive benefits as men do. And I think a lot of women don't realize that.
Yeah, I think most definitely. I think that a lot of times when women come in and I'm chatting with them and I tell them how important testosterone is, they are kind of like shocked and caught off guard because immediately they're like, that's a male sex hormone.
Yeah. I think it's out of all the hormones we do, I mean, there's controversy, it seems like, around all of them, but there's probably the most kind of misinformation and kind of like not quite as good of an understanding that people have around testosterone, because it is something that like people know about it, but they do, like we talked about, they associate it with like the performance enhancing aspects of it, or like bodybuilding or big muscles or like the sexual benefits and things like that. But, you know, we often talk about, and we hear from our patients too, that the mental benefits that you get from it and just the whole, you know, improvement in mood and mental clarity and cognitive function. Yeah. I mean, those benefits far outweigh, you know, kind of the physical. The physical almost is kind of like just a cool byproduct where you get those changes in body composition and you lose body fat and visceral fat. But I mean, the what it does for your well-being, I think, is the coolest benefit.
Yeah. The health benefits.
Yeah.
By far outweigh it. I think that sometimes we hear that too, like it being like a steroid, and people get freaked out about taking steroids or also taking something forever.
Yeah. When it's interesting, like the word steroid has gotten such a bad rap because again, it's associated with like the performance enhancing world and bodybuilding and things, but like a steroid hormone just refers to a hormone that's made out of cholesterol. So our body makes many steroid hormones. Testosterone happens to be the one that, you know, people know about the most. And so there's not a bad connotation with that word. And like with what we do with our testosterone therapy, everything's bioidentical. So whether you're doing an injection or like a compounded cream, the testosterone molecule is exactly the same as what your body produces. So it's processed the same, it's metabolized the same, and there's really no risks at all associated from optimizing your testosterone levels.
And men typically see results pretty quickly.
Yeah. Even when like Levi was on the other day, he had made a joke about just kind of like the placebo mental effect of like, oh, after I took my first shot, I felt it right away. But you know, there's really no way to know if it's like a placebo or if it's actually working, because it does start working right away. But men, I'd say within the first few weeks is kind of when they start to definitely notice those changes in mood and energy levels, you know, sexual function, things like that. And then, you know, 3 to 6 months down the road is kind of like everything else will start to come together, like sleep and just feeling better overall. And then you start, you know, 6 to 12 months is when you really start to see like those health parameters improve, like your lipids and your visceral fat and your bone density and like all the really like beneficial long-term health stuff, I think
takes some time.
Takes a little bit more time. But as far as like people noticing how they feel, like for guys, it's fairly quick.
Yeah. And for our women, it's a little bit longer, it can be frustrating. I think some of the things we see right away is libido for women. So usually, typically, even in the first couple of weeks, a lot of females will see that benefit.
Yeah.
Sometimes they don't see that benefit, but it can take a little bit longer, especially because we have to titrate them so much slower to get to those optimal levels.
I think that's, I know that's one of the things that you have been communicating with them, especially lately, just because of like, it's really important to set the expectation of the timeline of it, because like women, we really do want to get their levels optimal and get them to like a really good range, but unlike men, you can't do it right away. Like a guy, you can get his levels optimal instantly, right away, and he's good to go. But yeah, like women, you have to be conscious of like minimizing those side effects, you know, kind of like, you know, hair growth or acne or things like that. And so titrating them slowly really is a process, but if you set the expectation, I think it helps.
Yeah. And we talk about how it enhances like mood and stuff like that as well. But I feel like for women, a lot of us see like if we go too fast, we will get more on the irritability side.
Yeah.
So that's something that we have to be aware of too.
Do you think that some of the women, when you talked about noticing libido right away, like, are they surprised?
Yeah.
at that.
Yeah.
Yeah.
Yes.
Yeah. And then,
Especially if their husband isn't taking testosterone or addressing his hormonal issues as well.
yeah. Yeah.
It seems to be.
Yeah. And then I know on the flip side too, it can be frustrating for some of the ones that are not seeing that change right away. That's one of the things that they're looking for, but it's not happening as fast as they want to.
And that's hard too, because I think that a lot of other things go hand in hand with that. And so we have to sit down, have to have those conversations of being patient. But I know that we have some patients that, have been on antidepressants and stuff too. And so we've had to they've weaned off of them, and now we're kind of getting that fresh start. So everybody's story is different.
Yeah.
And I had the phone call with 2 different ladies yesterday. Both have been doing hormones now for a couple months, and they're doing great. But we had that talk, both of us, about, okay, you're taking your hormones are improving, but is your diet changed? Is your exercise, is it improving? Like, what do these dynamics look like in your life? Because you have to make the investment outside of just taking your hormones too.
Yeah.
And it does make a huge difference.
Yep. Absolutely. Yeah. I think it's, I try to stay in touch with a lot of the guys, throughout their treatment and their journey, to just remind them of that, because sometimes it's easy to fall off track. Sometimes it's easy, I've noticed, to like, you feel like my testosterone level is great, so I can maybe like slack off a little bit on my workouts because I have this to kind of compensate for it. And like, that's not really how it works. And so like we talk about all the time, like, you're going to get out of it what you put into it.
Yeah. And it will help with motivation too.
Yeah.
So it takes time too.
Yeah.
So it's not an over the night.
Yeah.
Okay. So let's talk a little bit about some of the protective and the benefits of starting testosterone.
Yeah, great point, because we focus a lot on like the feel good effects and the physical changes, but we'd mentioned earlier, like seeing kind of some of those long-term like health outcomes improve. And so we've seen, with the medical literature and like what we've seen in practice as well, is that like, cardiovascular parameters, like your lipid profiles, changes in blood pressure, visceral fat, insulin resistance, all these triggers that, kind of push you into like a state of like cardiovascular disease or even like type 2 diabetes. Like, we see all these things improve over time with testosterone therapy. And, we're talking like years, right? This isn't something that's going to happen in like 3 to 6 months or even 12 months, but like, you see the changes over like 1 year, then 3 years and 5 years and longer. Like, according to studies, if you look at like 10 years out, even with testosterone therapy, people are still seeing like the improvements in all those health parameters like that far out. So, all the, notion of like that it causes like cardiovascular disease or prostate cancer, some of the 2 big things that, doctors and people used to get hung up on, like those things have been thoroughly disproven at this point, and actually shows that, testosterone is protective of, cancer and cardiovascular disease and diabetes and Alzheimer's disease.
Yeah. And we see that on blood work. We see the results where like their panels come back looking a lot better over time. But even like with my son, when he came to us last summer, where his dad has the genetic issue with lipoprotein A. And so he wanted to test that. And then we put him on a few different hormones. And just within like 4 or 5 months, his lipoprotein A came down like within 12 points, which is pretty remarkable.
Yeah, it's cool because, lipoprotein A is one of those things that's generally considered like, it does appear to be extremely, hereditary and genetic. And it's really kind of reflective of, you can have a good, healthy lifestyle, but you can still have a high lipoprotein A because of, genetic traits. And it's typically looked at as something that you can't really reduce.
Well, that's what they tell you.
That's what kind of like Western medicine will tell you.
Yeah.
But we know through our training that, things like really, really optimizing testosterone and really optimizing estradiol levels will over time lower that number. And so, it's cool to kind of see that change. And I wish more people knew about that because it's,
it's pretty amazing.
Yeah.
But you were talking about like optimizing estradiol. That's a great subject to talk about, because a lot of times we get guys questioning us about taking AIs. Yeah.
So the whole, estradiol level with men is really kind of misunderstood a lot. And so I think a lot of the misunderstanding comes from, like the bodybuilding community, when they're using very, very, very high doses of, not only testosterone, but a lot of like synthetic hormones. And there was a lot of polypharma going on. And so it's like, you can't really compare that to what we do in the world of like hormone optimization and testosterone therapy. But like, it's like what we see with men is like, when we optimize their testosterone levels and their estradiol subsequently is going to rise, but that's what's actually providing a lot of the like endothelial function and cardiovascular benefits and increase in nitric oxide, like all these things that are going to help the cardiovascular system actually come from having those healthy estradiol levels. And, you know, the other thing that it gets a bad rap is because you can look at some of the literature that shows like an association with, you know, things like diabetes and obesity with high levels of estradiol. But if you really look at the literature, what it'll show you is that the estradiol is kind of like an innocent bystander of high levels of visceral fat.
Yeah.
So, and the visceral fat is what's going to produce the estrone that kind of converts upstream into estradiol. So it's not the estradiol that's causing the obesity. It's just kind of, like I said, a bystander of the high levels of visceral fat. But when we look at like when we actually either give estradiol or, you know, raise it through testosterone, we see nothing but positive health outcomes.
So, you know, a lot of times we're even talking about the benefits of testosterone with osteoporosis. We have a lot of women coming into us, and that's kind of one of the things we really see with women as they age is their bone density. And so it's pretty amazing that if even starting off early on, like addressing the hormones before menopause and getting ahead of it.
Yeah. It's like you can graph, like with women, you can graph, you know, the loss of hormones and like particularly estradiol with an increase in cardiovascular disease and osteoporosis. I mean, it's like a direct correlation, and it's directly tied to that loss of estradiol that women have. And so going back to like what we talked about with men, same benefits with women, right? Like they need healthy levels of estradiol. They need healthy levels of testosterone to have, you know, good bone mineral density.
Yeah, and I know we don't like to talk about numbers, but that's something that we hear quite often. Like, I know my ladies, they're like, okay, so we're going to do follow-up blood work, and where do we want my numbers?
Yeah.
And so it's we kind of have to like overcome that, that a number isn't something we're looking at. And like, I might feel really good where my testosterone level is, and I've worked years to get here, but it's going to take you time, and you might feel really good at a lot less than myself or someone else.
Yeah. That's one of the reasons why I think, you know, we're not, you know, super concerned a lot of times with blood work, and we're not, you know, we don't look at it probably as often as some of these other clinics that are like, you know, every 2 to 3 months or something, they're doing blood work to like evaluate numbers. And like, we don't really kind of follow that model, and we kind of spread out doing blood work a little bit further because of that reason. I mean, it's like, sure, you can look at a number and it can help guide your therapy a little bit, but ultimately like we're concerned about symptom resolution and optimizing health. And so, yeah, you're totally right. And sometimes they can almost be they can kind of get in the way a little bit, and they can kind of
like a mental
cloud.
block.
It can be a mental block. Yeah. Someone can, we've seen like their perception of how they feel will change based on what they see the levels of certain hormones look like.
What do you say the importance of testosterone is? Like if somebody comes in and they're like, especially for women, if they're like trying to figure out like maybe what the most important hormone to address first, what do you think that is?
Well, I think that, you know, for women, you know, testosterone, and then we talk about thyroid too, but like testosterone and thyroid are going to be the two that make the biggest impact in terms of like how you feel.
Yeah.
Like the things that you're going to notice, like, oh, like I have more energy. I have an uplift in my mood. I don't have, you know, as much, you know, irritability or depression if you're dealing with those kinds of things. Like libido jumps up. So like all those feel good effects, like that's going to come largely from testosterone and then thyroid as well. But again, the same thing with like, you know, helping, you know, they all work together to help kind of reduce the visceral fat, which is going to be the root cause of basically the insulin resistance and the inflammation that's causing all these like age-related diseases.
Yeah, especially when we have so many women coming in with PCOS too. So, and then they usually are complaining about the midsection of gaining weight.
Yeah.
And so addressing with testosterone first and foremost is really, really important.
Yeah. I mean, you can look at like all the long-term studies with testosterone and just like purely from a weight loss aspect, like long-term, like when people just, and again, there's not really a lot of studies with women. So we kind of have to look at the studies with men and how this works. But like long-term studies with men on testosterone, you see like significant and sustained weight loss over time that you don't see with any other, you know, modification. So whether it's even like diet, even the, what's the surgery? The
gastric bypass.
The gastric bypass surgery. Even those surgeries over time, you see people tend to gain the weight back.
Yep.
Whereas like testosterone over time, you see steady, like sustained weight loss over time. And so like, it's probably the best, you know, mode of treatment that we have for that, even though that's not technically something that we prescribe testosterone for.
And it's not a quick fix.
No.
I think that's really important. A lot of times people want that instant gratification, but you will get the feel good in the beginning, but it takes time. And it's something, we hear all the time, well, is this something that I have to take forever? So helping people understand that it's just like anything else, taking vitamin D or any other supplement, like as long as you take it, you're going to get the benefits and the protection from it.
Yeah, absolutely. Yeah. We have that conversation all the time with people. And I think comparing it to vitamin D is a great one because vitamin D is technically a hormone. People don't understand that either, but it's like people have no problem taking something like that because they understand the benefits they get from it. But as soon as you stop taking it, you're not going to get those same benefits from it. Same thing with testosterone or any of the other hormones.
So let's just wrap things up really quick. Let's kind of go over the benefits for both men and women.
A lot of times we talk about just the feel-good benefits. So like improvement in libido, energy, mood, just an overall sense of well-being. And then you've got like the long-term benefits, like the protection against cardiovascular disease, Alzheimer's disease, diabetes, osteoporosis, those types of things.
And thank you again for joining us today in the Gray Area with Rev Health. Like always, please like, comment, share, and subscribe, and we will see you next time.